This one's a cool video because when you study plastic surgery and you study beauty, we talk about different aesthetic rules in terms of symmetry and what makes somebody beautiful. If you remember like the Office episode where they're trying to decide if Hilary Swank is beautiful, it's interesting they pick Hilary Swank because Hilary Swank aesthetically has some of the most symmetric contoured features of any actress out there. So she's, in theory, what we define as aesthetically beautiful because she's perfectly symmetric. However, what we often see is deviations from that symmetry become beautiful. Madonna's gap in her teeth, Cindy Crawford's beauty mark, Adam Driver people think is absolutely gorgeous even though he defies all of the rules of symmetry. And so symmetry does not always equal beauty. Beauty is always in the eye of the beholder, but it's fun to kind of see this computer animation showing symmetry in these famous models and what their asymmetry that they actually have is. Just Galaflex or Galaform or Galatea. It's a mesh which acts as an internal bra. The mesh is made of something called P4HB, which is poly-4-hydroxybutyrate. Essentially, it's a chemical that your body already produces and has, and so your body breaks it down over a period of 18 months. When it dissolves, it leaves a very thin layer of scar tissue behind that's about 10 times stronger than the natural tissue, and so that just helps keep that breast where we put it. People hear internal bra and they think, oh, it's going to lift my breasts. That's not what it does. What it does, though, is when we're doing a lift or a reduction or putting implants in, it will help keep them there for a longer period of time. Great product. I use it all the time. Is it for every patient? No. It's still a foreign body, has about a 1% infection risk, but in certain patients, I won't do the surgery without it. In certain patients, I tell them it's a great add-on, like a bell and whistle, and then there's other patients I'm like, no, you don't need it. So in the right patient, it's a great tool.
Celebrity secret procedures?
Yes.
Okay, so there are some lesser known procedures like segmental liposuction.
Segmental liposuction is liposuction around the jawline. Do I think that's lesser known? Maybe. It does take somebody very skilled in liposuction who knows what they're doing to create a nicely contoured neck and cheekbone. The reason for that, there's some nerves that run right under the jawline that you've got to be very careful of.
Another similar procedure is buccal fat pad excision.
Buccal fat pad excision is often used in conjunction with liposuction of the jawline. We remove the buccal fat in the cheeks. This was popularized by Bella Hadid, and by removing that fat, you create that kind of contoured look. Very simple operation, takes 30 minutes. The biggest issue with that operation is it can cause some swelling and some firmness, and so you don't really see the full results till it's been about 3 months. It's getting more traction. I don't know that it's quite secret anymore. Balloon devices that are being expanded and used to open nasal passageways. In severe cases, they'll actually fracture the nasal bones outward, and the reason that a shifting of the nasal bones can actually help with a headache is there are certain types of migraines that are caused by compression of different nerves within the face. This is actually a relatively new operation. It's migraine surgery. I think I'm one of the only surgeons in about 4 states that does this operation. It's discovered just about 20 years ago by a plastic surgeon in Ohio, and it turns out in certain types of migraines, not all, surgeries like a rhinoplasty or a nerve release behind the eyes or on the back of the neck can actually provide relief of these migraines. These are for untractable, can't leave the house, you've got a migraine like 3 to 4 times a week type of patients. Don't do this. This procedure is unsafe. It can damage other structures in the nose, including the cribriform plate, which can cause a CSF leak from the brain and you can die, and don't do it. Don't do this.